Depression disorders have begun to grow at an unbelievable rate since the turn of the century. Now, close to 2 in 10 people living in America experience a major depressive disorder in their lifetime. The rate of depression is continuing to grow in America, as well as new techniques are being conceived every day to battle depression. Now, whether you have depression or not, you are affected by the immense amount of people in America who do have depression. In this speech, I will discuss with you a few topics of depression, specifically what depression is, the causes of depression, how depression can be combated, as well as how it impacts society. Now, with that being said, let's begin. Depression is a serious mental illness that will affect the victim's entire life, and depression has become such a common subject today that the term depression has been used lightly in the eyes of the public. Some people may describe depression to you as a feeling of a few upsetting days, but let it be clarified that this is not depression. Now, clinical depression, also known as major depression, is an intense disassociation inside of a person that can limit the person and is convinced of complete hopelessness, as well as feeling paralyzed in a constant state of sadness. An episode of major depression can last as short as multiple weeks to multiple years, depending on the severity of the individual's depression. Now, depression disables a person's entire mentality and personality by degrading their characteristics. Depression is not a light subject, and there are many causes to each case of depression. The cause roots of an individual's depression varies from each case. Common root causes of that structure of an individual's depression are being the victim of bullying, a death of a loved one, self-hatred, a failure to obtain life desires, divorce, as well as traumatic events. Everyone has the potential for depression, but it is these life events that brings it out. Now, let's look at depression and how it impacts our society and the members within. Depression causes negative personal effects on the body and negative effects to American society. Looking at American society, depression affects the annual incomes and increases government spending as well on healthcare. With depression disabling huge amounts of people, work productivity is cut, less money is being cycled through our economy, as well as additional money and services are being provided to counteract the depression epidemic. The National Center for Biotechnological Information stated in 2012 that individuals with depression lose 5.6 hours of productivity time at work per week compared to 1.6 hours of non-depressed workers, which results in 225 million lost workdays and 36.6 billion of salary equivalent lost productivity per year associated with depression. Now, this is affecting government pricing and taxing because of less productivity and more needs to sustain for the public. Depression is a thorn to humanity, and researchers are using old and new methods to battle depression. There are ways to possibly counteract some of the individual cases, yet a societal answer to end depression has not been successful. Antidepressants are a common way the medical field combats depression. When an antidepressant is consumed, the user's brain chemistry is altered by the drug to decrease the negative emotions such as sadness in the user's brain. A user of an antidepressant is at risk to become suitable to the drug and rely on that drug source strictly for their source of relief. This is very similar to the reliance of people who consume drugs like alcohol and marijuana. In an interview with Emma Pappas, depressed individual, she states that the lack of help from her antidepressants, rather they temporarily numbed her feelings. Antidepressants work on altering brain chemistry, with everyone's brain chemistry being different. It's hard to assume antidepressants is a good solution to take. Professional therapy has been another common practice against fighting depression. Therapy should not be looked upon as a function in which a depressed victim is attending with definite results. The outcome of that person will not be depression-free. Therapy consists of a depressed victim attending a conversation with a licensed professional. The licensed therapist will try to identify causes and proper solutions to help the patient. It helps many depressed people to identify these root causes in the depression, but it is ultimately up to the depressed individual to take it from the therapy session. A possible solution in depression on a societal level is awareness through education. American society could use the American education system to prevent depression in future generations. Now, this is a technique I myself concluded with the best solution to combat depression on a societal level. The American government requires every citizen of school age to participate in a school system serving as a reliable vessel to educate America's youth. For this process to work, annual school events should be hosted by each school with their enrolled students as the audience. In this prevention event, the students would be educated in depth on depression. Every student in the American education system would be educated on the knowledge of how to seek and how to prevent depression in themselves and their peers. And this is known that the severity of the future depression could have on a person if not prevented in their early stages of growth. I am sure this solution could cut depression in half, working for a better future. Now, not every solution has promising results. Depression is something we as humans have struggled with since early times. In conclusion, depression is hurting America, hurting individuals, and hurting our society. The current solutions we have in place have not proven to rid depression on a societal level, but we are continuing to push for better solutions. Thank you for listening to me today.